Serious people of Reddit who have gone through or are going through cancer, what was the first sign that made you go to the doctor? I felt a pop in my back. It was actually a vertebra breaking. I had severe pain after and was later diagnosed with multiple myeloma, a blood cancer. That was 5 years ago, and today I'm in remission. Yay. Congrats. D. I had what I thought was a stroke and found out I have a glioblastoma. I was given 12 to 15 months, and so far I've made it to the 15th month. Keep going. My self-diagnosed IBS was actually a tumor and it hemorrhaged. Stage 4 rectal cancer. I beat that, but it is in my liver now, too big to operate. I'm living my best life while I can. Man, I wish you good luck. I also diagnosed myself with IBS. What were your symptoms before the blood? Sup, unintended weight loss or finding blood where you normally wouldn't. Get yourself to a doctor. What is it about tumors that causes these two symptoms? I had a persistent pain in the middle of my sternum. Doctors thought it was costochondritis, essentially just inflammation of a joint. I stopped working out and lifting heavy things for 3 months, but it didn't go away. Eventually I started having night sweats and random aches. After I fractured my hip, I got an MRI and biopsy, and they diagnosed me with stage 4 non-Hodgkin's lymphoma. I got chemo, and I've been in remission for 5 years. Edit. I'm seeing a lot of people describing a similar chest pain and getting scared. Not all chest pain is cancer, and not all cancer is chest pain. I felt a pain in my chest because my tumor happened to be growing there. It could just as easily have grown somewhere else, and my story might have started with describing a persistent pain in the middle of my shin. If you're worried about something, talk to your doctor. My dad had non-Hodgkin's lymphoma. It started as a tickle in his throat, and then he lost his voice, as in he could not talk beyond the strength of a whisper. He chalked it up to a bad throat cold. Q 5 weeks later, and we finally got him to go to the hospital. Stubborn SOB that he was. Huge tumor put pressure on his vocal cords, which caused him to lose his voice and have difficulties swallowing. He went for chemotherapy, made it through, and was in remission for 7 years before it came back. Then chemotherapy and radiation again. Then it came back in his pancreas, where he had abdominal pain and other difficulties, but did not tell us. Listen to your body, please. As someone who has lost their loved one, if you suspect something is out of the ordinary, do not hesitate to bother the doctor about trivial issues. Be well. Take care, and all my best to you and your family. My dad went to the ER after a big bump had formed on his neck overnight. He was prescribed Severash medication, but went back after nothing had worked. Everyone, even the doctors, thought it had been an allergic reaction or some kind of rash, but after testing for other causes, they found that he had had Hodgkin's lymphoma and a 6-inch mar in his chest. It has been over a year, he has finished treatment, and the cancer shows no sign of returning. Edit. Thank you all so much for all the kind words and support. That's wild. Never knew lumps appeared like that. Seen as it was Hodgkin's, I'm guessing the lump itself wasn't actually the cancer, but an immune response / swollen node. Seizures. I got seizures out of nowhere during the night. No history of seizures in my family. Got my head screened, and they found what they thought to be a benign tumor, anaplastic astrocytoma, diagnosed 2 months before my 22nd birthday, nearing the 5-year mark, though, with no evidence of it returning. My dad had an aplastic astrocytoma and ended up seizing while in a bee suit in the middle of a parade, so that was awkward. Edit. Clarity. My 33-year-old husband was diagnosed with inoperable glioblastoma, most aggressive brain cancer, in January 2019, when he was 31. What caused him to get a check was persistent headache that didn't go away with paracetamols and sleep. We discovered the tumors after taking an MRI. Needless to say, our lives were changed forever. Now we are at the end of our journey, and it's been a harrowing experience for me as his wife and caregiver. It's a lonely journey. I don't wish it upon anyone, and no one has any idea what glioblastoma is like unless they have gone through it. The median survival time is 14 to 18 months. We are on our 18th month now, and given days / weeks left, Every day is a gift, and I'm glad I get to be holding his hands every day, even if he's resting and sleeping most of the time. As long as he is not in pain, and that the morphine patches are working, that is fine by me. I can't handle him going through any more pain. Edit. Thank you so much for sharing your stories, giving me strength and support, and I'm so blessed to even be receiving all of your kindness. It's such a touchy subject and I'm hurt all the time, but you guys being so kind really makes me cry happy tears. I'm so touched. I don't know how to describe it, but I feel a little bit lifted. And that's more than I can ask for from the internet. My husband, Victor, would have been so grateful to know that he is loved and supported by more people than he thought he was. Thank you. Watched 2 aunts do with uncles and my mom go through this with my dad. Caregiving is exhausting mentally, physically, emotionally, and spiritually. Wishing you as much peace as you can find. My dad was in bed one night and said he felt like he was drowning, then began coughing up blood. That's terrifying. What kind of cancer did he have? I was 17, getting ready for spring break back in 2010. Was making plans with my boyfriend on the phone because we were going to take his brothers to the zoo in a different city. Literally in seconds there's this big translucent blind spot in my eye that is orange. I can see dark shapes behind it, but it's super blurry. I figured I would just go to the eye doctor before I left the next day, but my sister, who actually works for the cancer center in my city, told me that I should go to the hospital because anything weird with your vision can be super serious. After 36 hours of emergency waits, driving to specialists, they finally admitted me to the eye ward for a bacterial infection. Then they took my blood for a routine blood test. Within an hour or so, as I was getting ready to sleep, a doctor and nurse come in. The nurse has a box of tissues. The doctor told me my blood is leukemic, to which I asked, okay, can I treat that? He was extremely unclear on what was happening. I was 17. My family had already left, and I had no idea about any cancers. I was diagnosed with acute lymphoblastic leukemia and started chemo that night after being transferred to a different hospital. They did a bone marrow biopsy the next morning and then sent it to a genetic lab in another province. When the test results came back, they changed my diagnosis to chronic myelogenous leukemia in the blast phase crisis, final stage, that was caused by the Philadelphia chromosome, where chromosomes 9 and 22 switch places and causes a mutation in my red blood cells. Told me I was the youngest person in the world with it, as 950 usually takes a very long time to progress, and the final stage doesn't show until around 65 years of age. That change in diagnosis changed my timeline. They had originally said 6 months to a year untreated, but now it was 1 to 3 months if I didn't get a stem cell transplant or bone marrow transplant. All this because I had blood clots happening all over my body because of the abnormalities of my red blood cell shapes, and the one in my eye presented itself in my vision since the vessels are so small. Edit. I guess I never finished off. I just celebrated 10 years in remission on June 17th this year and I'm healthy. My sister ended up being a 10/10ths DNA marker match, and I was able to get a stem cell transplant on June 17th, 2010. Still immunocompromised and taking dasatinib every day, chemo pill, but able to live my life. COVID has been really worrisome for me, but I'm just trying to be as careful as possible. Thanks for all the comments. And PS, I'm a female. The boyfriend was extremely supportive for a teenager and we worked together for 7 years before we parted ways mutually. I recently signed up as a bone marrow donor and these kind of stories make me hopeful for donating to someone in need one day. I hope I'm someone's match. Edit. Wow, this blew up while I was asleep. Here is the website for those who want to know more about the process or want to sign up. I actually personally signed up on this site, not sure if it's any different. I still sent in a cheek swab etc, but I don't think it differs. Last year, March 2019, I, male, 35, woke up in the morning to go to the toilet. I was urinating pure, thick blood with little lumps in it. So after a severe panic attack it began to hurt like hell. I was throwing up from the pain. After a day in the hospital and some scans and tests later, they told me to call my parents. So you know you're getting some bad news. It turns out it was kidney cancer. They removed my right kidney. Fortunately no other treatments were needed, and I'm living the best life right now. If the tumor in my kidney didn't started to bleed, I would have found out much later. Probably too late. Oh, and also I told myself 2020 was going to be my year. Duck 2020 and duck cancer. My brother was 11 when he started experiencing symptoms. He started losing a lot of weight, and when he was playing soccer it looked like he was running through mud and couldn't keep up with everyone else. My parents took him to the pediatrician and they couldn't figure out what was wrong. One day, he woke up and couldn't stop throwing up. When he tried to run to the bathroom, he kept running into the door frame and couldn't walk straight. He said the lights were giving him a headache. We took him to the emergency room, and they found that he had a brain tumor and had emergency brain surgery the next day. We were extremely lucky that they decided to do a CAT scan at the ER. Apparently they don't usually do them on kids. 2 brain surgeries and a year and a half of chemo later, and he is in remission now. As brutal as the therapy can be for kids, and for how scary childhood cancer is in general, I will say I'm glad a lot of pediatric cancers have a good response rate to therapy when caught early. I'm happy your brother is doing well. I went to my GP for blood in my stool, but they didn't give me any examine, and presumed it was a fissure, but tear from straining. I also had side pain and again wasn't looked into, and I had fatigue. Doctors again didn't investigate. They told me as I'm young, 27, and I didn't have a family history, that it wasn't a problem. One day I was at work, I had agony in my abdomen. My manager said I was pale. Went R&D, was kept in overnight, and turned out I have a very rare stage 4th bowel cancer which has spread to elsewhere in my body. Got my diagnosis a week later, and was on the operating table to remove a large part of my colon the following Monday. Now on chemotherapy, and tried to complain about my GP and they removed my review from their website, NHS Choices. Edit. Hey, so chemo took it out of me after I posted this, and yikes it's blown up, but I'm happy that in some way my comment may help others. Therefore I wanted to clear some things up that have been asked both in comments and direct messages. 1. The amount of blood was probably about a teaspoon worth of fresh blood on top / partially incorporated into my stool, and was happening every time. The reason was I had 2 tumors inside my bowel, one at each end, and as my stool was pushed through it, I guess it knocked them, causing the bleeding. The stool pushing against my tumors were the reason that I had the back pain. 2. As a few of you have figured out, I'm UK based, and therefore left my review both of Google as well as the NHS Choices website, and did receive email when my review was taken down from NHS Choices, which is a website specifically to review GPs and hospitals. I've worked in a GP and the GP practice have the ability to remove the complaint. I received an email informing me of the review being taken down and a request to speak to the practice manager. I was forced to leave that GP practice, as although I've moved closer to them and the hospital I'm being treated at, they said I'm not in their area, so I was forced to move GP by them despite moving closer. Before I left I also used the patient access app the NHS has and looked at my record and saw that my previous records at the GP did not record a lot of information that we discussed on my record. 3. I've not pursued legal action. My diagnosis was almost a year ago now, and as stated I underwent urgent surgery at that time. After recovering from surgery I was started on chemotherapy and have been having it for months with a welcome break at Christmas. I've considered taking it further. My mum considered it when this all happened, but it wasn't materialized. As per some comments I will investigate into this via legal advice subreddits as well as speaking to the CQC. PS. Thanks for the award, kind stranger. Hopefully it will make this be seen and help others who might be in a similar situation and make them get themselves checked out. Doctors are highly dismissive of colorectal cancers in patients under 50. There's a few campaigns to raise awareness of it in younger people, but looks like a slow movement. All the best for your future, man. Edit. Yeah, the bad pun wasn't intentional, huh? I was about 12 and I noticed a grey spot in my left eye, so I went to the eye doctor. It turned out to be retinoblastoma. And fast forward about 1 week I had my eye removed and started chemo, and now have a glad eye that has to get redone every 2 years until I was 16. Was it a small opaque spot or more of a translucent patch? If you remember, I have the faintest grey patch in my left eye's periphery and I'm on the verge of making an eye appointment, lol. On Christmas Eve 2018, my dad lost the ability to talk except for the phrase "this is crazy." Called paramedics because we thought he'd had a stroke. Got him to the hospital where the imaging showed a brain tumor on the outside edge of his brain. The swelling caused him to have a seizure. He was transferred to a bigger local hospital. They did full body scans. Because it's pretty rare to just have brain cancer, usually it's a secondary for another cancer site. We got lucky in that it was the sole spot. Went through a craniotomy and 5 rounds of high dose inpatient chemo, and he's 1 year in remission. Thanks for the awards. Super heavy periods that would last for 10 or more days. Got an IUD to help control bleeding. Actually hemorrhaged so bad the IUD came out. Endometrial cancer, huge tumor in my uterus. Ladies, it's not normal to need a tampon and pad at the same time. It's not normal to need to change them every 10 minutes or even every hour. An average period is 2 to 3 tablespoons. Just for reference. Sorry if TMI. Edited to @ thank you for the well wishes. I'm 1 year Ned. No evidence of disease. I was diagnosed at 40. I wish I could respond to everyone. The main takeaway is, if something is not right, keep looking for answers in the right physician. Heavy periods do not usually mean cancer in premenopausal women, but there is no reason to suffer through them. Postmenopausal women should not experience any bleeding. 1 drop and you should go to the doctor right away. The idea that this is TMI is why women struggle with these issues in the first place. Thank you for sharing. Funnily enough, it was a totally unrelated lump. Nope, that lump is fine, just a lipoma. However, we found another lump in the corner of yours, Ray, and we need to biopsy it. My mum had something pretty close to this. Had a stroke, so lots of scans. One of them just caught the edge of something. Tennis ball sized mar in her chest. Whack. Turned out it wasn't anything particularly nasty, but it seemed crazy she never knew it was there. Removed. Reading this made all of the freckles on my face itch. Glad you're good now. I had childhood leukemia. When I was about 10, both of my knees started to hurt progressively more and more to the point where I was limping around. I also couldn't catch my breath. I remember this one lunch lady at school giving me cheers for being slow walking up some stairs, and I just didn't know what to tell her because I couldn't go any faster. I went to the doctor once and they said I sprained my knees. I played soccer, so it wasn't impossible. But they never got better. So I went back and they decided to take some blood tests just in case. Thankfully they did, because it turns out my red blood cells were 1/3 what they were supposed to be, hence why I couldn't heal and I couldn't get enough oxygen, ever. That was 20 years ago now, and I got lucky. I didn't relapse. I had friends who did and didn't make it. IDK. Kinda a personal story that I don't talk about much. Edit. A lot of people have seen this and shared some great, oddly similar stories. Hope everyone is taking care of themselves. But to answer a recurring question, I never did see that lunch lady again. She was gone. Unrelated reasons by the time I went back to school. Another edit. I also don't blame my pediatrician for not catching it sooner, and I did end up having an incredible medical team providing treatment for me every step of the way. I'm glad to hear you're okay. I was diagnosed at 43. For 2 years my gynecologist insisted that I get a mammogram as part of turning 40. I'm very small chested, so I thought it was a complete waste of time. In February 2013 I promised my doctor that I would get a mammogram before my next annual appointment. I was diagnosed in February 2014. Stage 2 breast cancer. There was absolutely no signs or indication. No family history. All the way up to the pathology results from the biopsy, I thought it was all a complete waste of time and money. The results came back positive. I have to go on Tuesday and get checked out. Breast cancer runs in my family. Dad's mom had it. About 2.5 weeks ago, I noticed a burning sensation on the underside of my breast. Last week, I noticed a small, about the size of the pad of my thumb, hard lump. Among other things. I hope all is going well for you. Edit. I was not expecting this to get as many likes as it did, so I will make use of it with this. To those reading, you know your body better than anyone. If something feels off, best to have it checked out. Could be something, could also be nothing, but it's always important to know. My dad thought he had the flu and went to urgent care. By the end of the weekend he had started chemotherapy. He had acute myeloid leukemia, made it 6 years though, so not bad. My 25-year-old sister was diagnosed with AML December. She is still going through treatment. It is actual hell. I'm her match and we are hoping for a bone marrow transplant soon. My nana. She had very loose bowel movements, which had caused her to get dehydrated. Her levels for electrolytes were way out of normal range. She later found out that she had a cancerous mar on her ovaries. They caught it in time and she went through surgery and chemotherapy. Everything is fine now. My stool has been loose for years now, and I'm always tired, but I never saw blood and I'm a student, so I figured I'm tired for that reason. Now I'm worried. My dad was acting strange. He looked disheveled somewhat, and was telling the same stories. Well, he's 86, that can come with age. But he was also swerving on the road driving, and he called me one day to take him to his doctor. Long story short, stage 4 GBM, brain cancer. Had surgery, was okay for a couple of months, but was gone a couple months after that. Good part was, had no pain and didn't suffer. Edit. Thank you. I'm sorry that your dad and your family had to live through that. My mom also had GBM, and passed 2 years ago at the age of 57. Such a terrible disease. Hugs to you. Testicular cancer survivor here. I had a dull pain one day in my right testicle. Didn't think much of it. I then took a shower and my ball felt different. It wasn't smooth. I just felt that something was different. I went to my doctor and asked him to check them to make sure things were normal. He did the check and didn't think things felt off, but ordered an ultrasound anyway. I went and did the ultrasound, and I didn't hear what they found. They just asked me to go back for another ultrasound. The next day I got told I had to go to the hospital to see the urologist. Within minutes of meeting the doctor, he told me I had testicular cancer and was having surgery that night. It happened so fast. I caught mine early. Now I tell everyone to feel your balls and know you're normal. You're so damn lucky. How old were you, and how do I do the self-diagnosis? My dad woke up with extremely sharp pain in his abdomen. Worst pain you can imagine, apparently, when you have a tumor blocking your intestinal tract. It wasn't until the pain actually woke him from deep sleep that he went to emergency room and they found it. He ignored any other pain up until then. Don't ignore your pain. It was a few years of absolute misery and now we miss him. Grandfather went through the same choose. Rural man, proud man, never liked go to the doctor, no pain was too much or too frequent. When he finally went, it was too late. I was fooling around in a mall as a kid. So my dad grabbed me by the neck to make me behave. He felt a lump on my neck and immediately began to get nervous. We went to the doctor the next day, caught the cancer before it spread, and was able to surgically remove it about a month later. Got super lucky. He felt a lump on my neck and immediately began to get nervous. That's a nice way of saying he almost shat his pants. My sister noticed a small painful lump in her breast shortly after having her second child. Doctor diagnosed a blocked mammary gland. A couple weeks later it still wasn't gone. Again doc said blocked gland. Months later it's still not gone, and she insists on getting a second opinion. Stage 3 breast cancer. Double mastectomy immediately followed by months of agonizing radiation and chemo, only to find out it's now stage 4. She's been stable for a few years, but now it's spreading again, and we don't know how long we have her. Trying to be as positive as possible. Please women, get a BRCA1 test to find if you're genetically prone to breast and ovarian cancer. My gyno does them for everyone, but most don't. You need to know, because it will sometimes cause you to get breast cancer early, which doctors don't expect and don't test for. Unbearable stomach pain in the middle of the night at 32. 24 hours later a 15 cm cyst was found in my right ovary. 6 weeks later I was told it was ovarian cancer. 20 days later I had a complete hysterectomy. I'm 34. In menopause. Cured and very lucky. Thank you NHS. This scares me. I have mild pain every time I ovulate, and a birth control I tried has led to me having terribly painful cysts that regularly burst and stuff too. I have had many scans, x-rays and ultrasounds because of it, and as an American I'm now in huge debt. I'm to the point I just live with it now, but I'm worried about it being something else eventually, and I know I'll wait until it's unbearable before I go in, because I can't afford for them to tell me it's just another giant cyst and looks like it's shrinking, won't do much damage if it bursts, and charge me a couple thousand again from several different accounts. But my family is like, well, national health care is inferior. Well, we don't have to get rid of private health care to have national care, and maybe if it's nothing major I could at least not be scared to go in, because how can I possibly afford more bills? My discharge started to look and smell really weird. What kind of cancer? I feel I must answer this question. I had signs of cancer for about a year before it was discovered, but my signs were not obvious. I had a backache that responded to mild doses of ibuprofen, so it went on for a while. I had been to the doctor on numerous occasions and was treated as a sort of neurotic, middle-aged lady with aches and pains. I was treated for fibromyalgia, meds made me nutty, told to get bandages, given cortisone shots in the knotty muscles on my back, etc. My husband finally accompanied me and demanded they do some blood work because he could tell this wasn't normal aches and pains. Very telling blood work was done, but ignored, probably because the doc saw no emergency. I was finally referred to another doc who did more blood work, then left town. I was begging for results to no avail. I became weaker and could not go to work. I became feverish and was at last crawling back and forth to the bathroom to get in a tub of cold water. Finally, my husband said, "We're going to the emergency room." When I finally got in to see the doctors in the they looked me up and down and asked questions. I meekly offered that there had been some recent blood work done, if that would help. They looked it up, and immediately I was put into a room and given him not sure how many units of blood. I was nearly bloodless. After a week of extensive testing, bone marrow test, MRI, and continual blood monitoring, a MR showed up on a cord scan. I had a softball-sized tumor growing behind my esophagus, and it was bleeding into my stomach and being digested as a rare steak would be. That's why I never saw blood in my stool. The doc who never paid attention to my blood work in the first place came in and prescribed me huge bottles of Vicodin. Needless to say, I never asked for her services again. I had a huge surgery, removing my stomach, much of my esophagus, my spleen, an adrenal gland and part of my pancreas. The surgeon wanted to go higher up on my esophagus, but if he did, I would never be able to swallow and would have to have a feeding tube. But that didn't matter, because they only gave me a couple of months to live. My husband said no to this and asked the surgeon, why not take our chances with chemo and see if that works. Thank God they did, because 8 years later, here I am. I didn't die, and I can eat almost anything. There is much more to this story, but I'm here to say that the cancer symptoms were not at all obvious. I had never had heartburn or reflux, never smoked, but yet the tumor was in my esophagus. It had wrapped its tentacles around my spine, and that is what was causing the tremendous back pain all those months. Bandages and cortisone shots did not quite cut it as cures for a large cancerous tumor. The pain after surgery was immense, but I never had that awful back pain again. I would say, having somewhat regular blood work is probably the best way to find out if there is an unusual imbalance. That is what finally exposed my cancer. I would add, since seeing a somewhat disbelieving comment on my answer, that yes, it is entirely possible to digest food without a stomach. And although I do believe smoking can cause cancer in some cases, I in no way intended to bash any smokers, but simply mentioned this because esophageal cancer is often linked to smoking. Thank you for all the comments. I hope this has encouraged someone. I know when I was told I only had a short time to live, hearing stories of survival greatly encouraged me. Another example of how sexism can actually kill you. To anyone who disagrees, do the research on how women's symptoms are treated versus men's and then come back to me. Close bracket. Trigger warning. Sex and blood. Cervix cancer. A couple of times during sex blood would just randomly pour out of me. Nowhere near my time of month and no pain. Turns out that is one of the warning signs. 3 surgeries later I have had my cervix, the mouth of the uterus, removed completely, bit by bit. They tried taking only what they had to, as lack of a cervix makes impregnation and carrying to term harder, but it kept reappearing. I hope it's done now. Edit. A lot of women and other concerned people have been asking me stuff, so here are the most common questions answered. Keep in mind that English is not my first language and that I'm not a medically trained person. It was during sex. He pulled out and it followed. It looked like a quarter of a cup. It was enough to literally pour out of me, and it pulled on the sheets. Light spotting or a few drops of blood during sex is probably just due to chafing of the fragile tissue in the vagina. No biggie. A lot of blood like this, or even just enough to coat your partner's member, is cause for worry. Do check your schedule, though. He may just have kick-started your period. It was not my period. It was nowhere near that time of the month, and in any case, never bleed that much or all at once. The blood was also fresh with no clots, like a nosebleed. If at any point, during or outside of sex, blood starts randomly pouring out of any orifice, not just the goo, get it looked at. Even if it stops on its own, it is not a normal reaction. Comments on knife play not appreciated. I was 26 years old when this happened, and it was relatively short time after having a scheduled pap smear, maybe 6 months. I had previously been treated for genital warts, thanks a bunch Kenneth, and have a low resistance to any wart-related vira, including the HPV virus, which can trigger cell anomalies in the cervix. I have since gotten the HPV vaccine, since even if I have already had this chiz, it will strengthen the immune system. Apart from dizziness and a slight fever, I had no side effects from the vaccine, and I really recommend getting it. Man, woman, all benefits. You can carry and infect women with HPV as a male. And for the love of gods, get your kids vaccinated. The procedure is called a loop electrosurgical excision procedure. These are done when you have localized cancer cells on the cervix and just removes the area with the abnormal cells. When the cancer is a higher stage, a hysterectomy, removal of the uterus, and or chemotherapy with radiation are the usual courses of treatment. Side/after effects of LEAP were very slight. I was sore and not allowed to swim, do heavy lifting, or have sex for 4 weeks. That was it. You can still get pregnant without a cervix. It is just harder because it isn't there to funnel in the sperm. You also have a greater risk of not carrying to term, but there are procedures to help with that. If you want more info on this type of cancer, go to Joe's Trust, Jostrist, so they can remove the cervix without taking the uterus. I had no idea. Well, I have a benign brain tumor which was diagnosed due to double vision and really bad headaches. I also have had a mild hand tremor for ages. I had radiotherapy 11 years ago, and now I have been diagnosed with a low-grade parotid cancer, which is a lump on my neck. Soon going to be having radiotherapy for that. Edit. The doctors have decided on proton beam therapy for me. By the way, brain tumor, benign epithelioid hemangioendothelioma, parotid cancer, mucoepidermoid carcinoma. This question hits too close to home for me. I'm currently fighting stage 4 rectal cancer that spread to my liver. I'm a late 50s male that was too stupid and arrogant to go get checked or have a colonoscopy when the doctor said I should. I thought I knew my body better than they did. That naive attitude will probably end up costing me my life. My family is what forced me to finally act, but unfortunately, too late. I have had digestive problems my entire life. Born with a faulty pyloric valve. Lousy eating habits, bad choices, lack of caring, have finally caught up with me. Everything has a price and the bill eventually comes due. I'm paying now. 3 years ago, in addition to my normal struggles, I started seeing red blood on the toilet paper when I went to the bathroom. Not all the time, so I kind of ignored it. It eventually started happening more often. I did not tell anyone or go to a doctor. I just ignored it. My family kept pushing me to get it checked. I finally relented. In January 2019, I had a colonoscopy. When I woke up, the first words out of the doctor's mouth were, "I found something very concerning. This is not good. 4 polyps." He removed 3, but the 4th was too large and too close to my anus. He took a bunch of biopsies. They all came back negative. Woo, or so I thought. It was recommended that I have it removed surgically, so in March, I had surgery and had it taken out. The surgeon wanted to remove the lymph nodes as well. It is the only way to be sure, but I said no, because that meant a colostomy. I was not ready for that. The biopsy from the surgery came back in late March 2019. Cancer. The dreaded C word. I was shocked but not surprised. I had brought this on myself. In some way, I deserved it. Again, the surgeon recommended removing everything to be sure. I said no. The chances were not great, but not zero, so I opted for chemo and radiation to see if that would get it. 5 weeks of daily chemo and radiation in May 2019. That was tough, and it took a pretty big toll on me, but I made it through. The August scans looked promising. My C level, the colon cancer tumor marker, was dropping fast. My doctors were optimistic and telling me good things. My November scans looked just as good. I was told I was in remission and they would monitor me for the next 2 years. Wow. Dodged a bullet, so I thought. Right after Thanksgiving, I get a call from my oncologist. My C level has increased again, and they aren't sure why. I need to get checked again. I waited out through the holidays. In February 2020, I have a CORD scan and a PET scan. I then have an EUA exam under anesthesia to check the original tumor. Not only is the original tumor back, but the cancer has spread to my liver. 3 lesions. I went from being in remission to stage 4 in less than 3 months. You talk about whiplash. My head was spinning. The hardest part was talking to my family about what was going on and what comes next. In April I started on infused chemotherapy, FOLFOX plus Avastin. 4 hours of infusion followed by 36 hours of a pump 1 at home. I did this every 2 weeks, 4 times, covering an 8-week span. I was told to pause after that, so I could deal with my liver. Time to up the ante. I got into MD Anderson to see the experts. I have a huge team of doctors and specialists trying to help me survive. Even though I was told by my local oncologist last year that radiation was a one-time thing and I had my lifetime dosage, MDA doesn't see it that way. They have a more specialized approach, so in June, I went through a second round of radiation and chemo. Twice a day for 13 days at the end of June. That was hell, and the following 2 weeks were just as bad trying to recover. I was honestly missing the infused chemo. Oh, and towards the end of the radiation, I paused the final treatment so I could have a procedure done on my liver to zap the 3 lesions. Then I finished the final radiation treatment the next day. My local oncologist called me ballsy for putting myself through that. In some ways, I felt like I deserved to suffer. I have slowly recovered from all of that, and I'm about to start back up on the infused chemo. I have 8 more rounds that have to be completed over the next 16 weeks. I have been hoping that by some miracle, this would cure my cancer. My doctors give me a less than 10% chance. All of this treatment is just slowing the spread of the cancer. As they have all been telling me for over a year, my only real chance is to remove the original tumor with surgery. I'm almost already facing a permanent colostomy at the end of all of this. If I had listened to my doctors last year and had that done, I might have saved some of this suffering and be cancer free. Or perhaps not. I will never know. In the meantime, I will continue to fight it. I will deal with the terrible side effects from the treatments. The constant running to the bathroom. The chisting myself time and again. The pain and irritation. The embarrassment. The humiliation. The sadness of knowing what I have and am putting my family through. I'm not afraid of dying. I'm afraid of letting my family down. All because I was too stupid to listen to the people that know more than me. Trust me on this one, people. Pay attention. Get checked early. Get checked often. Don't be me. Edit. Wow. I'm overwhelmed by the responses, the kind thoughts and words, and the gilding. Thank you all. In reading your replies in my original post, I can see where it may sound like I'm despondent and being too hard on myself. It reads worse than it is. I know cancer is an evil killer that is not prejudiced or biased. I did not help myself, but I know I didn't deserve it either. Another aspect I should have added to my post is that I'm adopted and I have zero knowledge or information about my birth parents. So my medical history is a complete blank. It was this reason and the pushing from my family that drove me to get checked for my kids. Subsequent genetic testing has shown that I do in fact have 4 variants, making me more susceptible to certain cancers. Now my kids know that as well. The message is simple. Get checked. If not for yourself, then for your kids and your family, present or future. You did not deserve this. A lot of people are afraid to find out what is wrong with them, and a lot of people put off health checks. Humans are imperfect creatures, so please don't think you were supposed to act perfect. You sound like a fighter. I'm sending prayers and well wishes your way. Brother started forgetting words, even while looking at object, could not say them, could write them, or even describe all parts of object, but not name like shoelaces. Soon lost peripheral vision, even before he could get to his primary doctor. All that within just 3 weeks. Diagnosed with glioblastoma in February and died in June. Your story hit me hard. My brother was a similar story, but kept him for a year. Duct cancer. Back in 2017, I had been having back pain for several months. I finally went to urgent care one day when the pain was unbearable. They sent me immediately to the ER. I was admitted to the hospital and was diagnosed with stage 4 breast cancer. It had spread to my liver and bones. My life completely changed that day. When faced with dying, I realized that I wanted to live. Before this, I had my suicide completely planned out. I feel like things happen for a reason and things work out the way they are supposed to. I'm a new person today. I spend every day fighting for a life that I wanted to throw away. I'm sorry to hear it. Did your cancer got better? My cat found my cancer and bugged me about it until I went to the doctor. My cat has always liked to lay on me and need part of my body with her paws. For 7 years it was random, various parts of my body. Then for about 6 months she started to focus on one spot on my chest. At first I chalked it up to her wanting to be closer to my face, but after a couple months I noticed that the spot she was focused on had become very tender. Then I felt a small lump in that spot. Due to my relatively young age, it took me a couple of months to convince one of my doctors that it was a potential issue, but eventually I got tested and had a pretty giant tumor in that spot, plus other tumors elsewhere. Yes, Kitty got lots of cuddles, wet food, and greeners as a thank you. I'm in the process of getting diagnosed with what is looking to likely be cancer, and my cat has also taken up obsessively licking the affected area. Even if it's not cancer, something's definitely wrong inside my stomach and she just won't leave it alone. They're smart little creatures. I was young and thought I was immortal. That weird scaly patch on my scalp, right along my hairline, must have been some sort of infection or weird pimple. It was only when it started to burn constantly and give off a prickly feeling did I go to the doc and find it was skin cancer. Hoa, this is all too real for me, man. For the past year I've had the same thing. I thought it was just dandruff, so have been treating it myself with anti-dandruff shampoo, but it never goes away 100%. Specifically around my hairline, it burns sometimes, but generally, if I resist scratching etc., it goes away. Duck man, I didn't think this was anything other than persistent dandruff, but this has made me book an appointment to my GP. Thanks man. Dry patch of skin on my forehead, wouldn't stop scabbing and then bleeding. Decided that was because I couldn't stop picking it. Ignored it for 5 years because I'm 1, that afraid of doctors, and 2, that incredibly stupid. Decided to leave it alone for 10 days and let it heal. It didn't. Finally got sick of worrying about it being basal cell carcinoma and went and got diagnosed. Basal cell carcinoma. It was dealt with pretty easily, but don't be like me. I had almost the exact same experience. It was a tiny little patch on my forehead that would regularly get caught on the towel while I dried my hair or face, then bleed. The doc took a scraping, had it diagnosed, and it came back BCC. On the day I was scheduled to have it removed, he had his assistant prep me for the procedure, then came into the room. After taking a quick look, he stated that the cancerous tissue was so shallow that the test scraping had actually removed all of it, so no surgery was necessary. They then sent me an invoice for approximate $600 for the procedure, which was basically having me sit in the chair. My mom found out she has cancer a week ago. At first she felt pain in her armpit, and naturally she did some research and found out that the people who have pain in the same spot have cancer. However, I didn't give it much thought as every cancer diagnosis is different. The next day she went to the doctor, turns out it's a tumor. The week after she tested the tumor to see if it's cancerous, and sadly it was. Tomorrow the doctor will tell her the plan for recovery. Please pray for her fast recovery. Edit. Thank you everyone for the support. I lost my dad to cancer 2 years ago when I was 12. Thanks for all of your prayers. I really hope my mom can recover through this. My brother, aged 24, had a pain in his lower back, so went to the chiropractor. Didn't help, so he went to a real doctor. Cancerous tumor is blocking the spinal cord. You have less than a year to live. Anyway, my brother lived 3 years more, but the last one was in bed. I'm so sorry. I lost my brother a week before his 24th birthday to all leukemia. He beat it when he was 14, and this time he had to have a bone marrow transplant. It didn't work, and he died a few months later. Most of the patients I've seen had some weird gradual symptom or symptoms onset that they either ignored or just assumed was normal, or at least they're normal. Fatigue despite not changing much in their life. Weight loss that was attributed to I'm never really hungry anyways. Weird headaches. Changing bowel habits. Pencil thin stool. Blood in stool. etc. Moral of the story is, don't ignore chronic symptoms. Please see your document. Moral of the story sometimes is also don't ignore your patients. Seems there are a lot of cries for help and a lot of doctors ignoring/dismissing them. Patients often get treated like hypochondriacs, but their reality is real. This can often cause people to not go see their doc, unfortunately. Removed. My head and neck area became very swollen. At first I thought I was just getting fat, so I worked out a lot and ate better. This did not help. I also went to a local clinic, and they thought it might be an allergic reaction and gave me steroids, which also didn't help. The thing that finally made me go to the emergency room and not leave until I had an answer is that I started to develop unexplained bruises on my chest. Turns out I had a huge tumor in my chest which had grown around my heart and was compressing the superior vena cava, so blood couldn't flow back down from my head. Not great. The good news is that it turned out to be very treatable, and I've been cancer free for 11 years now. My father-in-law, 65 or something, has been feeling lethargic over the years. A month ago he felt the left side of his body weaken and then intermittently go numb. MRI and found tumor on the right side of his brain. Cancerous and aggressive. Removed some in a successful brain surgery. He has between 6 months and 3 years to live. Doesn't help that he has kidney and heart issues as well. My mother began having numbness in her hand, and that became more frequent, and it led to loss of control. She was a heavy smoker and always coughed, but apparently the cancer started in her lungs. My aunt had chronic pneumonia, and then they realized she had cancer. This was 7 years later, and they were identical twins. Both smoked. My mother was also a drug speed user though. My cousin had throat cancer, and that was diagnosed pretty early, and she beat it. She was having recurring throat infections and loss of voice. But cancer disqualifies you from organ transplants. They all lived in the same house. I'm now selling that house. I wonder if you are required to disclose any of that. I'd be curious to test the house to see what lurks beneath. Probably cheap laminate flooring with formaldehyde mixed with poorly vented radon if you live in the States. Radon. This might sound really strange, but I felt high all the time. Like I was detached from reality. Hard to put into words. Went in, found a tumor, Hodgkin's and non-Hodgkin's at the same time. Damn it. That's me the last 2 months. Maybe I should get a second opinion. I was in a drum line in middle school and we used to do this thing with the drumsticks to sting one another. This kid got me real good on my shoulder blade and it caused an irritated growth. Doctor told us that it wouldn't go away on its own and would have to be removed. While in surgery to have it biopsy, my mom pointed out another bump on my back and asked the surgeon if it was the same thing. He replied no and that it was fine. My mom insisted, asking him to remove it just in case, so we wouldn't have to come back, and he did. The second biopsy got infected and I had to go on antibiotics, unknown at the time. The antibiotic prescribed to me I was allergic to, which did not have a good result. Got a call back for a results appointment that just happened to be on my 14th birthday. The surgeon never looked at me or said happy birthday. He just read the results and said sorry before leaving. It was scale 4 malignant melanoma. I never saw that kid from drumline that hit me again, but I think of him often because if it wasn't for him, I might not be here and I owe him thanks. I was 4. We were visiting my grandmother at work. Target. I still distinctly remember playing with the little dots on a Sprite bottle. I had to potty, so my mom took me to the bathroom. I peed and stood up. While she was helping fasten my pants, I looked at the toilet. It was full of blood. We rushed to the hospital. Turns out I had Wilms tumor. A tumor the size of a large grapefruit had ruptured my right kidney and I was internally hemorrhaging. I was rushed to surgery. Severe pain. I was 12 years old and woke up screaming and crying from the pain. Swiftly passed out right after. It felt like a knife had stabbed into my side and was just twisting over and over again. I had already had cancer once before, so my family took me to get an MRI right after I went to school, and they saw a stomach tumor and immediately had me go to the hospital to have it surgically removed. So it was unrelated and not a relapse. I can't imagine having cancer twice as a child or being your parents. That's so cruel. My dad had a nipple pulling in that he knew about for several months before mentioning to anyone. He now thinks it may have been a year before he actually mentioned it to my mom, who demanded he see a doctor about it immediately. He was diagnosed with stage 4 breast cancer. After chemo, a double mastectomy, and radiation, he is in remission. I would be remiss if I didn't include this on his behalf. Male breast cancer is not as uncommon as you think it is. Pay attention to any changes in your body and get yourself checked out. A lump in my boob I found accidentally in the shower. Nothing else, just the lump. I was fortunate I found it. I was in my early 30s and breastfeeding my second child. Statistically it shouldn't have been me. I'm 5 years from diagnosis and my current status is NED, no evidence of disease, which is the best you can hope for. Check your boobs. Do it regularly. And go to your doctor if you find anything you aren't sure about. My wife felt a lump in her armpit. The doctor was not concerned, but Wifey insisted they check it out. The ultrasound was concerning enough that they did an immediate biopsy, which came back as metastatic breast cancer that had invaded a lymph node and had grown to the size of a golf ball. It appeared not to have spread any further, touch wood, so after surgery and chemo she is doing fine, touch more wood, 5 years and counting. Edit, I should add that she had clean mammograms and they never found any evidence of cancer in her breast. Edit 2, and a huge shout out to the BC Cancer Agency. They were on top of it from the get-go and quickly got her through treatment. I turned my head and noticed a giant lump on my neck in the mirror. It didn't hurt at all and I hadn't noticed it before. I went to my doctor the next day and bam, lymphoma. That was 6 years ago, so now I'm officially considered cured. I started having seizures. At first they were small and easy random smell and really strong deja vu, and then I started having tonic-clonic seizures a year later. The one nice thing is that among growths in the brain, it is the slower growing ones that are more likely to cause seizures, so at least there's that. Have you beat it? Broken back. Cancer had eaten away into the bones and weakened spine. That's what happened to my dad. He ignored the pain until the cancer had eaten through his pelvis. Multiple myeloma. Removed. I was rubbing my thigh with my hands after exercise, and I felt a hard painless lump the size of a big jelly bean about 5 centimeters deep under my skin. I felt around in the same spot on the opposite leg and didn't find another one, so I went to the doctor. A bunch of scans later, I was diagnosed with myxoid sarcoma. It turned out to be a misdiagnosis as the tumor ended up being benign, but I still needed surgery and the nerves in my leg got ducked up. TLDR, if something about your body feels off, get it checked out. If my tumor had have been cancer, my prognosis still would have been very good because I noticed it when it was still small. Had a friend who pulled her back, did it camping. She just couldn't pinpoint exactly how or when. She dealt with it for a month and finally after Thanksgiving decided to go to the doctor to see if they could help. Pancreatic cancer. She passed away 45 days later. Fast forward 10 years, my sister's boyfriend pulled his back. He did pool and pest control work, so he figured he just lifted wrong. After a few weeks I reminded my sister of our friend and pancreatic cancer. She finally convinced him to go get it looked at. He passed away a little less than 3 months later. Pancreatic cancer has a 95% death rate, the one I fear the most. Deleted. I had a biggish mole on my chest. GF made me go to the doctors to get it checked out. Turned out to be malignant melanoma. If it wasn't for her persistence I would probably be dead now. I thought she was way overreacting, and I don't like going to the doctors. Edit. It was 7 years ago now. I had abnormal small amounts of bleeding after intercourses. Went for a pap smear. Do it once a year, but went in earlier because of symptom. Turned out I had early stage of cervical cancer. After few surgeries later, with 1 ovary removal, partial cervix removal and lymph nodes out, I'm fine. 2 of my friends, both of their partners had huge appetites, built like rugby players, loads of energy, always on the go. They both had a sudden loss of appetite, became really lethargic, and didn't poop for more than 7 days. Bowel cancer. Both died within 6 months of diagnosis. If something is out of the ordinary, don't ignore it thinking it'll go away. Get yourself checked out, that's what the doctor is there for. I knew a lady that went to the doctor for constipation and found out it was colon cancer and dead within a month. Crazy stuff. Don't ignore pooping, I guess. I had a white patch on the left side of my tongue. I do not smoke or chew tobacco. As soon as the hygienist saw it and I saw her face, I knew it was trouble. It was cancer and something I have to monitor all the time now. Every sore on my tongue or in my mouth is a cause for concern. Had 1 biopsy and 2 surgeries to remove it all. No chemo or radiation. Downside was the spots kept coming back, hence the 2 surgeries. THC and CBD oil was recommended to me. That was 2 years ago, and I haven't had a spot since. Yay. Almost the exact same story. 32. Don't smoke or chew, yet I ended up with squamous cell carcinoma on the left side of my tongue. Biopsy confirmed it. Now I'm having surgery next week to remove part of my tongue and my lymph nodes, then having my tongue rebuilt with part of my forearm. Gonna be a nightmare in the short term, but the doc said I'll be fine long term. As a doctor I will hazard a guess it was weight loss B, fatigue C, lump D, blood somewhere edit. I would supplement this by saying these are non-specific symptoms which are more often than not associated with cancer. In particular fatigue. As a patient, I just hope you're noticing that almost everyone on here who was ignored by their doctor is a woman. I have experienced this so much myself. I want to spread awareness any way I can. I finally figured out the magic words to my current doc, a woman my husband wanted me to talk to you about. I shouldn't have to resort to this method just to get to live like a normal person. I had extreme fatigue for over a year before I figured out the problem. Not her. And then she tried to argue with me about my fatigue not being an issue. I once had to take a nap on the bedroom floor because I didn't have the energy to crawl into bed after I got out to use the bathroom. I was pulling menstrual blood clots the size of tennis balls. I had uterine cancer. I was 32 and childless. Had to have a complete hysterectomy. I'm sorry. Happy you are alive. My grandma had headaches, but then on my brother's birthday we went out to eat, and she was practically in tears from the headaches. She scheduled an appointment, and they found a tumor. They operated the next Tuesday, and she was gone within 5 months. I was 15 when I started having super sharp terrible pain in my ankle whenever something touched it, which sucked because I was really into martial arts. Would be training, then hit it with my other foot or something and just drop cold and walk for minutes. Lived with it for probably a year or more, going to doctors who said it was a bad growth plate, or all in my head, or some other similar bullshit. After lots of scans over time they figure that it's a nerve cluster in there, so I have surgery to take it out. The whole ordeal almost ended there, but a university asked for a sample and they determined that instead of a nerve cluster, it was a sarcoma, soft tissue tumor, and the first surgery had just spread it around. After consulting with a few doctors near home who said they'd have to take my foot, or I'd lose most function and just limp for the rest of my life, we went to MD Anderson who said they could fix it. They had to cut out my tendon and most of the flesh in the area, replacing it with a cadaver tendon and muscle from my thigh, with a graft of skin from my thigh. Then it got a blood clot and started to die, so they took a blood vessel from my other ankle to replace the clotted one, and redid the graft with skin from my other thigh too. Totally clean since. Just had my 5-year checkup last week. I was 4. I didn't want to be a bother to anyone, so I tried as best as possible to hide the pain in my leg. My pre-K teacher noticed I was limping and told my parents about it. I was diagnosed with osteosarcoma and had my left leg amputated through the knee. This October will be 16 years since I ended treatment. Wife had recurring sinus infections for months, then uncontrolled burping/acid reflux. Turned out to be an esophageal tumor that had spread to liver and a few other places. Fought for 3 years, but is now in brain, and she is currently in hospice. I'm so sorry to hear this. Sending you love and strength. My friend had bone cancer. Her leg hurt for a few months, and when she finally told her parents about the on-holding pain they went to a doctor. Turns out she had really bad bone cancer and the leg was needed to be amputated because it was too late or else she would have died. The cancer also already spread to her lungs. It was a long process until she was healed. I'm glad she survived all of this. I hope the cancer won't return. So, always go to the doctor, even if it's just your knee leg that hurts. I'm sorry for every mistake I made. English isn't my native language, so I'm sorry about that. Close bracket. One lump on my underarm, no other symptoms. Had a biopsy and scans, and then was diagnosed with Hodgkin's lymphoma stage 2B. Turns out I had half a dozen tumors inside me but close together. Had chemo and radio, in remission within 3 months. Stopped treatment within 6. Life was on pause for a year. Been cancer free for a year now. Had a real bad cold I just couldn't get rid of. I felt worse and worse each day for around 4 months. Never went to the doctor because I was 30 and it was a cold and I had a $5,000 deductible. I finally go see a doc, get a piss poor examination and a script for antibiotics. I did feel better on them, but the day after the antibiotics course was over, I was back to feeling like hell. The day I finally went to the I was getting ready for work and had to sit and rest just from getting dressed. Then, I walked out to my car and had to stop and lean on the car to rest before even getting in. I got to work, and when my boss noticed I couldn't stand for more than 2 minutes without having to sit down, she insisted that I go to the After they checked my blood, the doc came in and basically told me that he's not sure how I'm still alive because I have a hemoglobin level of 2. A level of 8 is considered an emergency requiring immediate blood transfusions. At least now I know why I felt like I was dying. He tells me that I could be because of an ulcer or other internal bleeding, or it could be a cancer like leukemia or lymphoma. As soon as he said that, in my mind I said yeah, it's cancer. I had an endoscopy that night which found no internal bleeding, and throughout the night I needed 10 back-to-back blood transfusions. I woke up feeling like $1,000,000 because I actually had blood in my body for the first time in months. I'm super fortunate that doctors were able to move quickly with my treatment. I had a successful bone marrow transplant at one of the top hospitals in the US, and it'll be 3 years of remission in August. A runny nose. My father always had allergies, but the severity of his runny nose reached a point where he went from doctor to doctor trying to figure out what was going on. It wasn't until the 7th doctor when he was finally referred for a spinal tap procedure SPINAL %20 tap %20 LUMBAR %20 puncture collect 20 CEREBRO SPINAL %20 FLUID %20 FOR %20 testing to determine if his runny nose was actually a CSF leakage. Night after the procedure, we almost lost him. He had developed meningitis. Spent several days in the hospital. They didn't know if it was viral or bacterial. Some days they made us wear a full cover up, while others we could hold on to him without a face mask even. He recovered and now we wait for his results. Turns out it was a CSF leakage. The surgery to fix that was scheduled right away. He had the surgery and my mother and I waited to be called to see him. While he was still out, the doctor came to my mother and I and told us she found something near his pituitary gland. A small growth. She said she scraped some off and sent it to the lab. When those results came back, we found out he had chordoma, a type of brain cancer. Edit, link. My dad came back from a family holiday with me and my mum in February 2020 from somewhere cold, Northern Europe during winter, and just wouldn't stop coughing. We just stormed it was a horrible fever and kept treating it with hot water with lemon and honey. But we'd booked an appointment with his GP as soon as we'd landed, but that wasn't for another 2 weeks. At his GP appointment he was diagnosed with a viral infection and given a week's antibiotics. His viral infection wouldn't go though, no matter how many antibiotics he was prescribed. His GP prescribed the same set again, and we called 111 once to be prescribed a different set. Nothing. One night it got so bad that mum and I called 999. Since it was a non-life-threatening call, the ambulance said they'd be 40 to 60 minutes. In that time, dad stopped coughing as much and told us he felt okay, asked to cancel the ambulance and that just wanted to go to sleep. I said duck no, let the ambulance get here and let the people with medical degrees and training decide if you get to go to bed or not. They arrived, a senior paramedic well called Joe, late 30s, friendly, and a junior paramedic well called Sarah. They both do standard tests, an ECG and a review of his meds, antibiotics. Joe asks Sarah for her opinion, presumably for her training, and she says he seems fine. The swelling at his glands is reasonable and in line with a viral infection. Joe says, well look, it got so bad that you all felt the need to call 999. I don't like that at all, and despite not seeing any evidence myself, I want to drive him to R&D and get a blood test done. So I drove behind an ambulance at 11 PM to sit with my dad as he got his blood test done. Blood report comes back at 4 AM, all normal. We go home. Next day, hospital calls and asks us to come in as soon as possible. Turns out it's acute leukemia. Dad's still going through chemotherapy, but has doing great, and we've got our fair share of hurdles, but damn if he isn't a fighter and a fantastic role model. We're now talking about marrow donation and final stages of treatment. But goddamn, that paramedic Joe made the right call. Thanks Joe, if you hadn't trusted us, I might be telling a much sadder story. Uncontrolled weight loss. There were probably earlier signs, but that was the one that made me finally go to have the situation sorted out. I was 8 when I got leukemia, 21 now. The first unusual thing was that I was constantly tired. I'd just come home and lie down on the couch and wouldn't have energy for anything. My mom was just alarmed as I was a lively child, but she first brushed it off as school and autumn moods exhausting me. And then I started getting red spots on my skin. Not breakouts, just red dots appearing right under my skin. First on my face, then on my neck. Eventually they spread down to my chest. It happened within days and thankfully my mom called my grandmother, who's a cardiologist, and who ordered my parents to take me to a doctor. Other doctors cold said it was a skin allergy breakout. I suffered from skin allergies before that, but this one noticed the signs, ordered extensive blood tests, and then got me transferred to the hematology hospital within an hour. I still remember how I tried to be brave when they were taking my blood, and how proud I was that I was calm through that whole evening. And that was the start of over a year of hospital life. If my mom hadn't called my grandmother, if she then wouldn't order my parents to take me to the hospital, if that doctor then would dismiss the signs, which are not at all common with leukemia, I would have been gone within a week, maybe 2. If I came there days, hours later, I would have been beyond saving. But in the end, 8/9 me was happy to be allowed to spend whole days in bed playing The Sims 2, and that's what I choose to remember from that time. I'd also like to say that my parents are amazing people who made sure to spend every moment they could with me, all the while working to support us. Not all the meds etc were available through the local NHS, and they made this hard time so much easier for me. TLDR, I was HEO, was tired all the time, had red spots on the skin, was very lucky that came to the hospital quickly, and wasn't dismissed as an allergy, or I would have been dead in a week. It's really concerning the amount of people that say my doctor told me it was nothing, but I insisted, and then they found like WTF. Why are doctors so dismissive? I slipped on some stairs and shattered my left ankle. No doubt about it being broken. I could feel the pieces of bone moving. The whole time at the emergency room though I kept asking them to please also x-ray my right foot, which I believed was also broken. I even said that I felt like the 5th metatarsal was broken. The orthopedic surgeon was super dismissive and kept saying it was just bruised, that bilateral injuries are exceeding rare, etc. They had me on my crutches using my right foot for support. I finally said I wasn't going to leave until they x-rayed my other foot. Why'd I know? The foot they'd been having me jump around on for support, broken. Exactly where I said it was. Dark stools and intermittent lower abdominal pain. Went to the doc, and he said colitis, just don't eat nuts and seeds. A couple days later it still hurt and I ended up seeing a nurse practitioner. She ordered blood work, an abdominal CAT scan, and a gastroenterologist consult. 2 weeks later I had half my colon removed. Caught it fairly early, so things are looking okay. My eyes were doing something really weird. Bright flashes all over my field of vision, but generally only when I was moving from darkness into light, i.e. right when I woke up. I went to the eye doctor. They said probably macular degeneration. Not much they can do, so I just sort of lived with it and went on with life, feeling 100% fine otherwise. Thankfully I had a regular blood test from my doctor a few months later. Results came back so bad they said it had to be a mistake, because if these numbers were really you'd be literally unable to stand up, practically dead, and obviously you're not. So they chucked the results. Don't worry, these mistakes happen all the time. And ran another blood test. They called me up with results, said they were even worse than the first, and told me to run, not walk, to a hematologist. Didn't take them long after that to figure out I had a rare form of leukemia. My white blood cell counts were literally off the charts, making my blood super thick, like potato soup, my doc explained, and that was creating undue pressure in the blood vessels in my eyes, hence the flashing. 4 years later I've still got leukemia, but it's mostly under control thanks to some relatively new miracle drugs. Thanks, science. Oh, and my eyes are mostly back to normal, though it did seem to screw up my vision a little bit, so now I have to wear glasses. Grandmother once suddenly developed a lot of pain, seemingly from nowhere. She also felt completely drained of energy. Went to the doctor and was soon diagnosed with pancreatic cancer. She died 2 months later. Grandmother too started experiencing tummy issues, pain, cramps, upset stomach, painful and foul smelling gas. Turned out to be bowel cancer. Had it surgically removed and has been in remission for about 15 years now. She has since been diagnosed with IBS though, and because some symptoms match the symptoms she experienced with the cancer, she is so scared that it's come back. Goes to see several specialists a year on her own insistence because of anxiety about recurrence. Her IBS would be better if she didn't insist on loading up with every type of fiber there is, but she's so scared of dying Now that she insists on eating 10 types of fiber and 50 pieces of fruit and veg every day. This makes her IBS flare up, which triggers her anxiety, which makes her eat healthier, etc. Vicious cycle. Grandfather experienced some clotting issues, bruising etc. Was diagnosed with a type of leukemia that was very non-malevolent. It posed no real danger. Then a year later he developed pneumonia and the antibiotics he was given for it wouldn't work somehow because of the leukemia. He died about a week later. All but one grandparent have had some type of cancer, so I'm not all that optimistic about dodging that bullet myself. Only time will tell, I guess. Oh my, you watched until the end? That's fucking awesome, dude. Thanks for watching.